Bismillah ar-Rahman ar-Rahim. This case, actually, it's common in Arab board, Saudi board, Jordanian board, and Egyptian board regarding to Digitalis toxicity, and the cardiac manifestation and non-cardiac manifestation. We'll see our case today. This is 9-month-old infant accidentally ingestion of unknown quantity of what? Digitalis. And what is the most important non-cardiac manifestation of toxicity in this infant? So this patient, he take Digitalis. We don't know the amount, just we need to know what is the important non-cardiac manifestation of Digitalis toxicity. So fever, dizziness, vomiting, visual disturbance, urticaria. So the non-cardiac, it will be vomiting. Non-cardiac manifestation of Digitalis toxicity is vomiting. So the important non-cardiac manifestations of Digitalis toxicity in infancy is vomiting. Affected infant also exhibit electrocardiographic changes. There is some ECG changes you have to do. If there is any digital toxicity, you have to do ECG. There is some exhibit electrocardiographic changes. Include this is sinus arrhythmia like bradycardia and wandering pacemaker, and also paroxysmal tachycardia and heart rate of less than 100 beats per minute. There is some electrocardiographic changes in infancy. And the common use Digitalis preparation in infancy, it will be digoxin. And there is the actually digoxin blood level or therapeutic level in adult, it will be less than 2 nanogram per deciliter or less. In infancy, it will be between 1 to 5 nanogram, but the benefit of higher level in infancy is doubtful. So what is the Digoxin effect? First of all, this is cardiac glycoside, can used in treatment of congestive heart failure because what? It has inotropic effect on the myocardium. It's contractility effect, inotropic effect, and also can treat atrial fibrillation. Why? Because chronotropic effect, it will affect on the heart rate, and also can treat the atrial flutter because positive inotropic effect, and can use in the treatment of the paroxysmal atrial tachycardia also because positive inotropic effect. This actually the pharmacological class of digoxin is cardiac glycoside, and the therapeutic class it will be inotropes and anti-arrhythmic medication. So the Digitalis effect on the ECG, digoxin effect on ECG is not marker of digoxin toxicity. So it will be described like QRS SCT morphology. It will be slurred. If you will see here, this looks like slurred, or sagging, or scoping, or reverse tick, or hockey stick, عصاية الهوكي, or salvador Dale's moustache. عامل زي الشنب السلفادور ديلز مoustache. It will be scoping, sagging, slurred, hockey stick, عامله زي الهوكي stick. This is Digitalis effect on the ECG and is not marker of digoxin toxicity. So there is common questions. What is the digoxin effect on the ECG? It will be QRS SCT morphology, describe it as slurred, sagging, scoped, or reverse stick, or hockey stick, or salvador Dale's moustache. It will be hockey stick, or slurred, or scoped. You see scoped here, scoped, or sagging, or slurred. This is digoxin effect on ECG, and put in your mind, this is not marker of digoxin toxicity. What is the non-cardiac manifestation of Digitalis toxicity? Vomiting. You have to do ECG looking for digoxin effect on the ECG. This is not marker of digoxin toxicity. It will be QRS SCT morphology, slurred, or sagging, or scoping. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.